Welcome back to another deep dive. Today we're tackling something that affects millions worldwide, and it's been around for ages, scabies.
That's right, a really persistent issue.
And we're not just stopping at the basics. We're going to dig into how homeopathy, a very different approach to health, sees it and tries to address it.
And what the research landscape looks like, too.
Exactly. We've got a really interesting mix of sources for you today. Detailed materia medica reviews, some pretty eye-opening scientific abstracts from the Homeopathy Research Institute.
Right, the HRI.
Yeah, and even a compelling case study, a real-life example.
Always good to see how it works in practice.
Our goal, pull out the key insights, give you that shortcut to feeling well-informed, and maybe, spark a few new questions. Okay, let's get into it. So let's kick off with the basics, just for anyone who might not be totally sure. What exactly is scabies and what causes this, well, intensely uncomfortable condition?
Okay, so scabies is a contagious skin disease. It's caused by these tiny, tiny insects, mites actually.
Lights.
Specifically Sarcoptes scabii. People often call it the human itch mite.
Okay.
And these microscopic mites, they burrow into the very top layer of your skin. That's where they live, and that's where they lay their eggs. Yeah, and it's actually the eggs and their feces in these burrows that trigger a really strong allergic reaction from your body.
So that's what causes the itching.
Exactly, intense itching. You might also see these tiny blisters sort of along the trail where the mites have been laying eggs.
Yeah.
And the itching, it's usually much worse at night.
Oh, I bet that makes sleeping difficult.
Hugely disruptive, lots of restlessness, yeah.
Sounds awful. Where do these unwelcome guests typically set up shop on the body?
They definitely have their preferred spots, usually areas where the skin folds.
Okay.
So think between the fingers, the wrists, elbows, armpits, inner thighs, also behind the knees, between toes, groin area, buttocks, places like that.
And is it different for babies?
A bit, yeah. In infants, you might see it more on the scalp, the neck, and even the palms of their hands and soles of their feet.
Wow. And how easily does this spread? You mentioned it's contagious.
That would very easily. It spreads mostly through close personal contact. So direct skin-to-skin touch is the main way.
What?
But you can also get it from sharing things. Toiletries, clothes, bedding, towels, if someone infected has used them.
Right, which explains why it can spread quickly in certain places.
Exactly. That's why you see outbreaks in crowded settings, schools, care homes, sometimes even prisons, anywhere people are in close quarters.
And how long does it take for symptoms to show up?
Usually, after the first time you're exposed, it takes about 5 to 6 weeks for symptoms to appear.
That long? Wow.
Yeah, but if you've had it before and get re-exposed, symptoms can pop up much faster, sometimes just 1 to 4 days.
What happens if you don't treat it? Are there, serious complications?
There can be, yes. The biggest issue is the scratching. Because the itching is so intense, people scratch a lot, which can lead to open sores. And those sores are then really vulnerable to secondary bacterial infections, often with Staphylococcus aureus. That can lead to something called impetigo.
Okay.
And there's also a more severe form known as crusted scabies. You see this more in people with weakened immune systems.
Right.
In those cases, the person has a huge number of mites, literally millions sometimes, causing these really thick crusts on the skin. It's quite serious.
So, knowing all that, what are the best ways to prevent getting it in the first place?
Well, the main thing is avoiding that direct skin-to-skin contact with someone who's infected.
Okay.
And avoiding sharing personal items, clothes, towels, bedding.
Makes sense.
It's also really important, if someone in the household has it, to wash all their clothes, towels, and bed linen in hot water and dry them on high heat.
That kills the mites.
It should, yeah. And sometimes, depending on the situation, a thorough cleaning of the whole house, including carpets and furniture, is recommended too.
Okay, so we've got a good handle on what scabies is. Now let's shift gears a bit and talk about treatment. How do conventional or allopathic treatments typically work for scabies?
Right. So the standard allopathic approach usually involves medications called scabicides. These are designed to kill the mites.
Like creams or something?
Often, yes. Topical
Okay.
creams like permethrin ointment are very common. You apply it directly to the skin. Or there are oral medications like ivermectin.
Okay.
The goal is just to eradicate the mites and then manage the symptoms like the itching. And if there's a secondary bacterial infection like we talked about,
Right, the impetigo.
exactly, then antibiotics might be prescribed as well.
Seems straightforward enough.
Well, there is a challenge, especially in families or, communal living situations.
What's that?
For the treatment to be really effective and prevent reinfestation, Everyone in the household or group needs to be treated at the same time.
Ah, I see. Compliance could be an issue.
It can be. If not everyone follows the treatment protocol properly, recurrence is pretty common. You can just pass it back and forth.
Okay, that's a really interesting point about compliance and recurrence.
Hmm.
So how does homeopathy approach scabies then? What are its claimed advantages here?
Homeopathy takes a, well, fundamentally different path. It's not about directly attacking the mite itself.
Okay, so what is it about?
It's more about stimulating the body's own innate healing mechanisms, strengthening the person's immune response so they can overcome the infestation.
How does it do that?
It works based on the law of similars. The idea is using a highly diluted substance that, if you took it in a large dose, would actually cause symptoms similar to scabies.
Like cures-like.
That's the principle, yes. In tiny doses, it's thought to prompt the body's vital force to react and heal itself.
Interesting. And you mentioned something about a miasm.
Right. Homeopathic practitioners often see scabies not just as, a bug on the skin, but as a surface expression of something deeper. They call it a caloric miasm. It's sort of like an underlying, maybe inherited susceptibility or predisposition within the person's system towards certain kinds of chronic issues, often skin-related. So the treatment aims to clear the scabies and address that deeper imbalance.
So what are the claimed benefits of this approach?
Key claims are that it's individualized, tailored to the specific person's symptoms, not just the disease name. It's non-toxic because the remedies are so diluted. And generally, it doesn't have the kind of side effects you might see with some conventional drugs.
Okay.
And another potential plus, according to the sources, is that often only the person who actually has the scabies needs the homeopathic treatment, not necessarily the whole household simultaneously.
That could make things simpler logistically.
Potentially, yes. It reduces that burden compared to everyone needing treatment at once.
It definitely sounds like two very different philosophies going on. Now, inevitably, the conversation turns to scientific evidence when you compare these.
Yeah.
What do our sources say about the research situation for homeopathy?
Yeah, that's always a big topic, and it's complex. Our sources show different perspectives.
How so?
Well, on one side, you have conventional medicine, allopathy, which has this huge amount of scientific research, drug testing, regulation by bodies like the FDA, a really strong established evidence base.
Right, rigorous testing.
Exactly. Now, on the other side, our sources do acknowledge that homeopathy often, it doesn't have that same breadth of modern large-scale research for every condition. It sometimes relies more on historical use, case studies, and what they term mind-body approaches.
So a call for more research then?
Definitely. There is a clear and consistent call for more high-quality research in homeopathy across the board.
But it's not like there's no research, is there? Our sources mentioned the HRI conference.
No, absolutely not. There is research happening, and those HRI abstracts highlight some important points. For instance, one abstract critiques how some big reviews, meta-analyses, have looked at homeopathy.
What's the critique?
It suggests that sometimes conclusions saying homeopathy has no effect are reached by excluding a lot of the available studies, maybe because they don't fit a very specific, rigid model, or by using statistical methods that might not be best suited for individualized treatments, basically arguing that a chunk of the evidence gets overlooked.
Okay, so questioning the methodology of some critiques.
Right. But then, conversely, another HRI abstract points to 5 specific, high-quality, randomized controlled trials, RCTs.
The gold standard, usually.
Well, often considered so. And these specific RCTs did show a clear benefit for homeopathic treatment compared to placebo.
For what conditions?
Things like childhood diarrhea, ear infections, otitis media, fibromyalgia, and symptoms of menopause. The analysis found the odds of improvement were about twice as high with homeopathy compared to placebo in those studies.
So it's not black and white.
Not at all. It suggests that while maybe the overall evidence base isn't as vast or universally accepted as for some conventional treatments, there are specific areas and studies showing positive effects. The debate seems to be about how to interpret the existing data and absolutely the need for more comprehensive research.
That makes sense. It's a nuanced picture.
Yeah.
So let's dive into one of homeopathy's most distinctive features, that individualized approach. It's not one size fits all, right? It's about the totality of symptoms.
Exactly. This is really where the art and skill of homeopathic prescribing come in.
So let's look at some specific remedies our sources mentioned for scabies. What makes each one suitable for a particular person?
Right. The choice depends entirely on the unique cluster of symptoms the person is experiencing, physical, mental, emotional, everything.
Okay, let's start with sulfur. Our sources call it one of the best and most common remedies for scabies. What does a sulfur picture look like?
Sulfur is often needed when the itching is just unbearable, really intense, and it's characteristically worse at night, especially from the warmth of the bed.
Okay.
People needing sulfur often scratch until they bleed. Their skin might look kind of dirty or unhealthy, maybe prone to pimples or other eruptions, and there can be an offensive body odor.
Interesting.
Also, a key sulfur symptom is that itching often gets worse after a hot bath or shower. And like we mentioned, it's considered a major antipsoric remedy, addressing that underlying susceptibility.
Okay. Now, what about sorinum? Our sources highlighted that one particularly for cases that keep coming back.
Yes, sorinum is what's called a deep antipsoric nosode. It's often considered when scabies or other skin issues just keep recurring despite treatment.
What are the signs for sorinum?
Patients needing sorinum might have skin that looks really dirty or greasy, maybe with a very foul smell, even if they are very clean. The itching is intense, like sulfur, but often worse in cold air or when they're undressing, and they tend to be very chilly, very sensitive to cold.
And if the scabies presents with more pus-filled eruptions, those pustules?
Then hepar sulfuris might be indicated.
Hepar sulf. Okay.
Yeah. Think of scabies with pustules forming. The skin is often really painful and incredibly sensitive to the slightest touch, and also very sensitive to cold air or drafts. There's a tendency towards suppuration pus formation and secondary infection. The discharge from the pustules might even look a bit like cheese.
Burning and restlessness often go hand in hand with skin problems. What remedy fits that picture?
That strongly points towards arsenicum.
Arsenicum, right.
This remedy is great for dry, scaly eruptions where there's intense burning pain. And like sulfur, it's often worse at night, especially after midnight.
Okay.
The person experiences great restlessness. They can't keep still and often can't sleep because of the burning and itching. Their skin might be very dry, maybe killing in large flakes, and sore. And with arsenicum, the mental symptoms are also really key things like anxiety, fear, and being very fastidious or orderly can help confirm the remedy.
What about those tricky spots, like in the folds of the skin?
Causticum is one remedy often thought of there.
Causticum. How does that present?
You might see scabies symptoms with wet pustules, maybe foul-smelling pus. The skin might have a yellowish look, and sometimes warts are present too. It's known for eruptions in skin folds, like between the thighs, and the sensations are often burning, rawness, and soreness.
Any other unique signs for causticum?
An interesting one sometimes is involuntary urination when coughing or sneezing. It's what homeopaths call a concomitant symptom, something seemingly unrelated that helps pinpoint the remedy.
And lycopodium. Our sources mentioned that targets specific areas too.
Yes, lycopodium is often useful if the scabies symptoms are predominantly on the genitals, scalp, or abdomen.
Okay.
With lycopodium, the condition and the itching tend to get worse from warmth, like sulfur. But interestingly, the itching often gets better if the skin comes into contact with something cold.
Ah, opposite to hepar sulf.
Exactly. The pustules might be moist and have a yellowish-brown appearance.
Any other key remedies you think our listeners should know about from the sources?
Well, there are quite a few others showing how specific it gets.
Give us a couple more examples.
Okay. Sepia officinalis is often considered for people, particularly women, who feel worn out, indifferent, maybe a bit dragged down. The itching might come with ring-shaped eruptions, often in skin folds, and scratching brings no relief. It might feel worse in open air, but better in a warm room.
Right.
Then there's graphites. Think thick, crusty eruptions that ooze a sticky, honey-like discharge, often on skin that cracks easily or in folds. The skin generally looks unhealthy, prone to infection.
Okay.
Mercurius solubilis, we might hear more about this one later, is indicated when there's lots of sweat, often offensive smelling, alongside moist offensive eruptions that might be raw or bleed easily. Intense itching at night, worse from the warmth of the bed, and often worse in damp weather.
That sounds very specific.
It is. And maybe one more, meserium. Our sources mention this for really violent itching, eruptions covered in thick crusts, oozing pus underneath, and a characteristic burning sensation after scratching. And there was that really specific note in one source about maybe considering meserium if scabies or intense itching started after a COVID vaccine. Just shows the level of detail they track.
Absolutely. It really paints a picture of deep individualization, not just scabies, but this person's specific experience of scabies.
Precisely. And there are others too, like natrum sulf if itching is worse when undressing, or radium brom for a sensation of actual fire on the skin. It gets very detailed.
Okay, to really see how this works, let's walk through that case study from our sources. It's about an 11-year-old girl, Mrs. K, who had scabies. What was her situation when she came for homeopathic treatment?
Right. This case gives a good practical look. Mrs. K came in with these vesicular eruptions like little blisters and really intense itching, mainly on her left hand. It had been going on for about a month on her hand.
Okay.
But the whole thing actually started 4 months earlier on her right inner thigh. Initially, it had a clear, watery discharge, but later that turned yellowish and pus-like. Though, interestingly, the report notes there was no bad smell.
And the sensations.
She described intense itching and a burning feeling. Both were worse from warmth, worse at night, and specifically worse from the warmth of her bed.
Okay, that sounds familiar from the remedies we just discussed.
It does. And another key point, washing the area with water actually made the burning worse. And because she scratched so much, there was sometimes a bloody discharge.
Had she tried other treatments?
Yes, she'd previously used the conventional permethrin ointment. It gave some temporary relief, but then the scabies came back. This happened after she had contact with classmates at her residential school who had similar symptoms.
Ah, the recurrence issue we talked about. So those were the specific physical symptoms. But you said homeopathy looks at the whole person. What else was considered about Miss K? Her overall health, her mood?
Exactly. The totality of symptoms is crucial. In Mrs. K's case, they noted several things. Since starting at the residential school, she'd been feeling very homesick, cried frequently, and was easily frightened by small things.
Okay, emotional factors.
Yes. But despite that, she was still generally active and cheerful during school activities. Other things noted were an unusually increased appetite described as ravenous hunger, an aversion to sweets, which she used to like, and her sleep was very disturbed because the itching was so bad.
So homesickness, fear, changes in appetite, sleep patterns, all considered alongside the skin symptoms.
Absolutely, all part of her unique picture.
So with all these details, the specific skin symptoms, the emotional state, the general physical changes, how did the homeopath figure out which remedy was the right one for her?
They used a process called repertorization. It's quite systematic.
How does that work?
Essentially, you take all the unique characteristic symptoms the patient has described.
So like the itching, worse from warmth, the burning, the homesickness, the hunger, avoiding sweets.
Exactly. All of those. And you use a homeopathic repertory, which is like a large index or database that lists which remedies are known to produce those specific symptoms. You essentially map the patient's symptoms onto the remedies. The remedy that covers the most characteristic symptoms and covers them most strongly or intensely is usually the one selected.
And for Miss K?
In her case, the repertorization chart showed Mercurius solubilis Mercsol as the top-scoring remedy.
The one you mentioned earlier with the nighttime itching and moist eruptions.
That's the one. It covered 19 out of 19 of her recorded symptoms, and with the highest intensity rating. Other remedies like sulfur, phosphorus, causticum, sepia, lycopodium, arsenicum also came up, but Mercsol matched her complete picture most closely.
So Mercsol was chosen. What happened then? What was the outcome of her treatment?
Well, initially, right after the first dose, things didn't dramatically change overnight. The eruptions were still there, the discharge was still present.
Okay.
But the report notes the bloody discharge from scratching lessened a bit, and the itching and burning were slightly reduced. Her hunger and sleep problems continued at first.
So a gradual process.
Yes. Homeopathic follow-up involves monitoring changes closely. With subsequent appointments and carefully timed doses, the case notes also mention Sac-Lac, which is a lactose placebo, often used between doses of the actual remedy improvement, started to become much clearer.
How long did it take?
By November 15th, which is about 2 months after she started the treatment, her vesicular eruptions were visibly getting smaller, the discharge was much less, and her itching and burning were reported as being 75% better.
That's significant.
And her appetite had become more normal, and her sleep had improved quite a bit, too.
And the final outcome?
By the end of November, November 30th, her skin was clear. No eruptions, no scars left at the site, no discharge, no itching or burning sensations. Her appetite was good, eating normally 4 or 5 times a day, and she was sleeping soundly for 6 to 7 hours a night.
Wow.
The case study even included before and after photos, which visually showed the skin completely clearing up.
That's a really compelling illustration of that individualized approach in action, isn't it? Seeing how all those different symptoms pointed towards one remedy leading to that resolution. Okay, we started this deep dive looking specifically at scabies, but you mentioned the HRI conference, and our sources definitely hint at a much wider world of homeopathic research. What other areas are being explored? Are there surprising findings coming out?
Absolutely. It really does raise that important question about the broader applicability of homeopathy. Those HRI London conference sources give us a glimpse into just how diverse the research efforts are, well beyond just scabies or even just skin conditions.
Let's talk about cancer supportive care. That's such a critical area, managing side effects of conventional treatments.
It really is. And interestingly, in France, homeopathy is apparently quite widely used by cancer patients specifically for supportive care.
To help with side effects.
Exactly. Expert consensus recommendations have even been developed there. They note that homeopathic medicines don't seem to interact with conventional cancer drugs like chemotherapy or targeted therapies, and they don't have significant side effects of their own. That's obviously a huge potential benefit when patients are already dealing with so much from their main treatments.
Are there specific studies?
Yes, one study looked at breast cancer patients undergoing radiotherapy. An integrative homeopathic protocol significantly reduced the severity of radiodermatitis, that painful skin reaction from radiation.
That's a common problem.
Very common. And another study, also in breast cancer patients getting radiotherapy, found that homeopathic treatment improved fatigue and issues with attention or focus compared to a placebo group.
That's really impactful work. What about some of the more, well, unexpected areas? You hinted at environmental stuff earlier.
Yeah, this is where it gets really fascinating and maybe pushes the boundaries of what we typically think of. Homeopathy is actually being explored and used in agriculture.
Like for crops.
Yes, and on cattle farms, especially in organic farming, also in zoos, and even sometimes with wild animals during epidemics.
Wow. How does that work?
Well, one study mentioned looked at Artemia salina tiny brine shrimp. They were exposed to pesticides and heavy metals. A homeopathic approach called isotherapy, which uses highly diluted preparations of the harmful substance itself, seemed to offer a protective effect.
How so?
It reportedly reduced the number of malformations in the shrimp and improved their overall activity levels compared to those not receiving the isopathic treatment.
That's intriguing. And the water study you mentioned.
Right. This one is really thought-provoking.
Yeah.
Researchers added a highly diluted homeopathic preparation, Phos-30CH, phosphorus, to a natural water source.
Okay.
They measured the water's dipole moment, basically a measure of its electrical polarity, and they found significant changes in this measurement after adding the homeopathic prep. What's more, these changes were detectable quite far downstream, even up to 72 hours later.
Implying the effect traveled through the water.
That's what the study suggests. It opens up possibilities, or at least questions, about whether homeopathy could have a role in helping disturbed environments recover. And of course, it begs the question, how could that possibly be happening?
Exactly. Which brings us to the mechanism question. How could these ultra-high dilutions, where there's often mathematically no original substance left, actually have a biological or physical effect? Are scientists looking into that?
Yes, they are. This is the absolute core challenge for homeopathy from a conventional scientific perspective, isn't it?
It really is.
But recent research, highlighted in our sources, is proposing some potential explanations. The idea is that these ultra-high dilutions are not just plain water or solvent. They might actually form complex structures within the liquid.
Structures, what kind?
They're being called nanoassociates. These are thought to be tiny, organized clusters, potentially involving both leftover molecules from the original substance and the solvent molecules, like water, arranging themselves in specific ways.
Okay, nanoassociates.
What's really interesting is that these proposed nanoassociates seem to carry a negative electrical charge, and their charge and size appear to change in complex, nonlinear ways as the dilution process continues.
And the electromagnetic field connection.
This is crucial. Studies suggest that if you shield these ultra-high dilutions from normal background electromagnetic fields, the EMF that's all around us, these nanoassociates, don't form properly. And apparently, their unusual physical properties and any biological activity they might have seem to disappear.
Wow. So EMF might be necessary for them to form or be active.
That's the hypothesis. It leads to this idea that homeopathic dilutions aren't simple solutions, but maybe more like complex, dynamic systems where water structures organize, perhaps powered or influenced by environmental energy like EMF and certain chemical reactions. It's a potential physical basis that's being actively researched.
And the shaking.
Yeah.
The succussion.
That seems important too. Other studies using techniques like the droplet evaporation method, basically looking at the patterns left behind when drops evaporate, show that succussion does change these patterns even at relatively low dilutions. It suggests the vigorous shaking physically alters the liquid during the preparation process.
So the research really covers a lot of ground, from clinical outcomes in patients to trying to understand the fundamental science. What other clinical areas are showing promising results according to these sources?
Beyond the cancer care examples, the research mentioned covers quite a spectrum. There was a study on COPD, chronic obstructive pulmonary disease. It suggested a specific homeopathic medicine, oscillococcinum, significantly reduced how often patients got upper respiratory tract infections, and also led to fewer flare-ups of their COPD.
Okay, respiratory infections.
Yes. Then dengue fever. In cases where dengue caused low platelet counts, thrombocytopenia, adding homeopathy to standard treatment apparently led to a significantly faster rise in platelets and quicker recovery.
That's serious.
It can be. Also, acute encephalitis syndrome, AES, in children. An open-label randomized trial suggested that adding specific homeopathic medicines to standard care significantly reduced the risk of death or ending up in a persistent neurovegetative state.
Wow, that's a major claim.
It is. And then more everyday things, too, like primary teething in babies. A public health initiative used certain remedies, like Canocaria phosphoricum for teething discomfort, and others for related issues like diarrhea or colds. They reported positive effects on teething patterns and fewer illness episodes in the kids involved.
Interesting. Even animal studies.
Yes, there was one with Magellanic penguins that had elevated liver enzymes.
Penguins, okay.
Yeah. Treatment with a homeopathic preparation of Carduus marianus, milk thistle, significantly lowered these enzymes, apparently with results comparable to conventional treatment but without noted side effects.
From penguins to people. What about something like back pain?
Sciatica, specifically. One study tested an individualized homeopathic treatment approach and found it led to improvement in pain intensity for a significant number of the patients.
That really is quite a range. Humans, animals, environment, fundamental physics. It's a lot to take in.
Well, that was definitely a deep dive. We've journeyed through the specifics of scabies, how homeopathy approaches it, and then zoomed out to this really broad landscape of global homeopathic research.
We really covered a lot. From the very individualized totality of symptoms approach in practice, aiming to work with the body's healing response.
Right, using remedies like sulfur, Merxol, based on very specific patient pictures.
All the way to exploring its role in supporting cancer patients, potential environmental uses, and even research in zoos.
And tackling that fundamental question of how these highly diluted substances might actually work.
Exactly, delving into those ideas about nanoassociates and water structure.
That discussion around nanoassociates and the potential influence of electromagnetic fields, it certainly leaves you with something to think about, doesn't it?
It really does. It suggests there's maybe still a lot we don't understand about how biological systems interact with subtle influences, whether internal or external, and how different interventions might work on levels we're only just beginning to explore scientifically.
Absolutely. And that consistent call we saw in the sources for more high-quality research, especially studies that look at homeopathy as a complete system. The consultation, the individualization, the remedy, all of it.
Comparative effectiveness studies, they call it.
Right. It highlights that ongoing effort to really understand and quantify its effects and potential benefits in the real world alongside other approaches.
So wrapping this up, what does this all mean for you, our listener? Maybe it's just a reminder that when we think about health, about healing, there isn't always just one path or one philosophy.
There are diverse approaches out there, each with its own perspective and body of evidence, even if that evidence is still evolving or debated in some cases.
And the quest for knowledge, especially when it challenges our usual ways of thinking, is always ongoing. So here's a thought to leave you with. How might exploring different treatment possibilities and the science, or perhaps the emerging science behind them, open up new ways of thinking about your own health, your own well-being, or just understanding the complexities of healing itself?
Definitely something to mull over.
Until our next deep dive.